Okay. But it should be afterwards naman. Because I will be video. Conference. Hello, good morning. Yeah, thank you. And yes, let's go. I think she go inside already. Pure stuff.
Yeah, so this one is mainly about how it works, how you set it up, and then you've got studies, and then also the different procedures you can use on. No.
If you hold it here, and then you use the handle to do the rotation. I'll hold this for you. Do you want to hold that?
Usually, yeah. Give him,
hold you a bit. I'm down next week in New Cross, Wolverhampton, so I can pop over.
So the ears are there. Yeah, so you're like,
Yeah,
and then that was that's something that really nice. Yeah.
well, exactly.
Screw this on and then press the button, and the former is so it limits any exposure to like the harmful sides of the formalin.
Sometimes we say infection in the eyes.
Yeah, or on your hands, on your skin, and just the inhalation as well. I mean, it's carcinogenic, so
Yeah, it's very
It's the
good.
worst thing when you've got the big pots. You have to like fill it over with like
exactly.
this.
Trying to keep away from it.
Yeah. Even though you've gone and you're like, blood,
Oh, there's just some.
Another coffee.
And then some companies will have multiple syringes, so they'll have a small, medium, and a large. So with this one, you just attach on the balloon here, and then all you're going to do is inflate, and then the balloon inflates. You have your lock here, and then you have your extraction balloon. So the idea with this is you go up and above the stone, and then you're going to pull down the stone outside of the ampulla. So this can obviously be changed to the various different sizes. You can do that by using the nozzle here to turn to let out some air. That reduces the size. You can also go back, obviously, to the beginning, and then the consultant says, okay, inflate to 15, so you blow up, just past 15, allow it to come back, and then you lock that off. Everyone understands that there? So this is often the go-to for a first use within stone extraction. You'd always use a balloon first. Some doctors may try a basket first, but it is unlikely. The majority of people will always use a balloon. And that is pretty much as simple as that what it gets. As I said, you've got your injection for contrast. That can either, depending on which balloon you've got, would either inject below the balloon or will inject above the balloon. Majority of ones used inject above, so you can see the whole of the biliary tree. Once you've cleared all those stones, what they're going to want to do is to get what's called a cholangiogram. So that basically tells you that there's no debris left, no stones left in the tree, and then that is the procedure finished. If this doesn't work, this is when we sort of move down the table on the other options we've got. So, place that one down there. So the next option we can go to is a basket. So these are just different ways of catching the stones. So instead of going above and beyond, what you're going to want to do is try and catch the stone in the basket. So it's like you're going fishing. So this one is this is a hexagonal basket, and then this one is a spherical basket. Let's open up. So you see you've got two different types of shapes. So these are just really just for different shaped stones or different sized ducks or doctor preference. It's really completely up to you. And how these work is, as I said, you're basically going fishing. So they're going to open up the basket. The stone hopefully gets lodged in there. They probably end up giving it some backwards and forwards force to try and wriggle the stone inside. And then on the handle, on your end, you again have your contrast port. That always gives you your visibility. And then on the top, you've got your open and close function. So once the stone gets inside here, let's say, got it with a pen. You're going to close around the stone, great tension, got a hold of the stone, and then you'll end up pulling that through the biliary tree and then pull it out into the duodenum. So again, you're achieving that stone extraction just in a slightly different way. These can be sometimes useful if the stones are in the little side branches, so they're not as easy to get to. So that's why often baskets will be used as well. Does that make sense on the basket? So they're your two sort of removal options. If for whatever reason the stone is too large or you have a narrow duct, you have to then think about how am I going to break the stone or change the size of the stone to then remove it. So if your balloon doesn't work, your basket doesn't work, you then come on to the far end of the table, which is what's called lithotripsy. So this one here, I haven't got an actual table product, but you can sort of see how it works and I'll explain. So this has the same basket as the spherical one, the twist and catch. However, this has an integrated lithotripsy handle. So this is wire guided, and then on the handle itself, basically you've got this section here, which goes onto the handle and can create tension on the basket to crush the stones. So this is often the first option, is what's called a extraction and lithotripsy basket, or alternatively, you have the heavy duty option, which is this big one. Feel the weight of that. It's quite heavy handle, and this is what's for mechanical lithotripsy only. And this is often like the last resort, is what people say. And this is used to crush some of the more firm calcium stones. And I'll explain how that works now. So with this one, different to all the others, this one isn't wire guided. So on this, you have to cannulate with the basket, and you don't have the ability to have the wire guiding where the basket's going. So this comes as is, so it's ready to go, and it comes out of the box. There is some other companies out there where they have the handle separate to the spring in the basket, so they have to be built in the room. This one is ready to go. So the first step is you've got your slider here. This pulls out your catheter. Once your catheter is out, you've then got your handle, and that'll open your basket. So and then that's going to pop open. I appreciate this one is a little bit deformed, we've used it quite a few times, but you can see it's the same basket size as this one here, and also the extraction. And again, it's the exact same technique as you would with trying to extract. So you want to try and get some tension on the stone, you'd grab some tension, and then with this one, the only difference is you want to think, I always want to crush stone with metal on metal. So you go back to your slider, pull the slider down, your stone is then back touching the metal, and then you continue to crush. If for whatever reason you need some more power, this handle also has a second function, just where you pull back, and then it feels a lot lighter here, but the force transmission into the stone is a lot greater. So that'll crush even the hardest stones. If for whatever reason, which does happen once in a million, but can happen, where the basket gets stuck, you do also have to be aware that there is an emergency handle. If for whatever reason that doesn't work, it would be a surgical option, where the patient would have to go into actual surgery to get that sorted. So it's just to make you aware. Obviously, there's the steps you take to get to this point, but this is a viable option. There is one other which we haven't talked about, and what that is something called endoscopy. So you might have heard of something called spyglass. So that is lithotripsy with the EHL. So EHL stands for electrohydraulic lithotripsy. So instead of mechanical, using a basket and a crushing mechanism, it's using water and pulses. So that's another option instead. So a lot of centres will also have that available. I just don't have our version of that today, but that is another option for stone management. So that's sort of the pathway from balloons to baskets and then your mechanical lithotripsy. And that's hopefully everything you need to get rid of stone. If for whatever reason you can't get rid of your stone, often the doctor will then do what's called a plastic stenting. So they'll always make sure that they can get drainage from the biliary tree. So that's often with a double pigtail stent, and that'll be placed over the wire, and that'll just ensure that the patient doesn't become jaundice. They'll come rebook the patient in a few weeks or months' time, come back, and then they'll try and remove the stone again. So there's always options to do, but hopefully you can solve it on the day and they don't have to have a second procedure.
Yeah. Okay. So you've got the rotatable wire there as well, so you can rotate it in any way and you can control that rotation. So instead of it just completely going round, you can control that however much you want, which the doctors love because you've got timing on you. And the doctors are always like, come on, hurry up. So yeah, you can have a go at that. The polyp in there. You've got a sieve in here so that the polyp's just left, and then it's just sieves through, okay? So anything else is just left in here, so you're just left with the polyp. So you don't need to fish it out. The ones you have, you may need to fish through it, you might need to. With ours, you do get a little pick as well, so you can have a little pick on it. That way you can just literally pick the polyp out without damaging the polyp and put it into this pot as well. With this as well, it's really easy, so you pop it in, hear the click, the polyp goes in, it's in there, you pop this into the histology pot and you go straight back in with the next one straight away, so it's a very fast procedure. That's what the doctors love, they want it fast, they want to suck the polyps out to go through again. So many times as you want. And with this one, you can see that the jaw swings, so it gives you a better bite. So instead of just it being like stuck, you can only bite that, it swings on the jaw. So you can see that as well. You've also got here, so you've got like a little timeline here running, so the doctors like that, so you can see where they are in the scope. So we just want to
And what it does is, instead of like with the clips that we've just deployed, it's a linear closure, so it closes from left to right and it brings the tissue together. What happens with the padlock clip, it closes the defect circumferentially. So with a normal defect, you'd probably have to place multiple. If you have like a perforation, something like that, you'd have to place loads through the scope clip, where with this, it brings the whole thing. We're showing this afternoon, so make sure you come back so you can have a go deployed.
Does it have different sizes or just one?
No, just one size. So there's two sizes depending on which scope you're using, but the clip itself is the same size. The same size. Yeah. But yeah, you make sure you come back.
Exposure to formalin, because most people are not aware that formalin is actually very harmful, and it's in the EU legislation to actually, if you are working with formalin, to reduce the exposure or completely prevent it in the working environment. So what this does is where the formalin is actually inside the lid instead of the pot. So once you put the specimen in and you close the lid completely, you release the formalin from the top, give it as well, and the formalin comes out inside the pot but fully enclosed. So you're not exposed to it whatsoever. And it's literally to look out for the safety of the clinical staff who work with these pots. And we've got two sizes, the 20ml and the 60ml for like bigger biopsies or more biopsies.
So after putting the samples, we will just
Yeah, so make sure it's screwed on. Exactly.
So after closing it, just press it.
Press it, give it a little swirl, and it literally runs down there. Yeah.
Not the one that is pre-filled. The one
Yeah, because when we are opening, we are
And you're
smelling
smelling it. Exactly.
What's the what's it called? Harmful of formalin?
Cancer.
Cancer.
Formalin for cancer. This is a fertility problem. It's serious.
Oh.
We don't know that one. Every day we are
I'm putting my hand as well. I'm putting my hand. And I'm taking a lot of formalin in the theater for the ESD.
Me too.
I don't have mask. I just have the gown and
Only
gloves.
gown. Going to gloves I'm using.
Oh, cancer. Oh my god.
No more. With full PPE. So if it just comes to our hospital, it's good for us.
Yes.
That's it. Is it completely closed? Just make double check. Where's it coming from? Oh, from the list. Yeah.
So you do long press?
So it should click. So I would technically advise just put your. Can you hear that click?
Need more energy.
Yeah, exactly. And then give
But
it-
it's good actually. We want to explode.
Exactly. So it's actually very widely used in like Europe because we are a Danish company. We're well established in Denmark for about 30 years. We are a brand new market within the UK. So we're trying to raise awareness initially about the exposure to
This one is more expensive.
Maybe.
So it is a little bit pricier to tell you that. Exact price is just dependent on what you that the department do. Yes, you can take a seat. So whatever you want. Help yourself. Are you guys endoscopy nurses?
Yes.
So you guys do quite a lot of biopsies then?
Yes.
You guys know how it works. In order for that to be true, there's a couple of things you need to follow every time you use it. First of those things is that before you put the powder on, so the next step now is to get your powder. That just screws on top there. Before you do that, always make sure the lever is down, this red lever. So the lever controls your valve. Right now, you'll see the lever is down, it's closed, and the lever's up. Valve's open, it's open, it's closed. Yeah? Open, closed. So you always want to make sure it's down, i.e. the valve is closed before you put powder on. If it's open and you put this powder, you leak powder into your catheter, you're wasting powder, and it means that when the catheter is going down your scope, you'll get powder everywhere, you'll create a gel in your scope, and you'll clog your catheter. Alright? So always make sure the lever's down, then you can get this. It's just a screw in, so unscrew that, keep it upright, and then screw it on. Okay? So always remember not to turn your powder upside down, because it will just go down. That's all you need to remember to set it up. Catheter slides on, powder screw. Right? The next step now is that once you've assembled it, you then give this over to your scopus, because they're going to be the one that feeds it down your scope channel. Before you do that, always make sure the powder is going. This means that you'll get airflow through your catheter when you're feeding it down the scope. If there's any moisture sitting in that scope channel, we'll push it out. Right? So turn it on, give it to your scopus. Do you want to be my scopus? So I'll turn it on, I'm going to give it to you. Pretend that's our target site. So you're going to go down. Make sure the tip doesn't come into contact with the site. Basically leave a 2 centimetre gap. And then we want to point it less than 90 degrees because that means none of the particles will scatter back. They'll let you know when they're ready to start spraying it. You can put them out there. And then that's when you open up the lever, 2 fingers, and open it half the way. Give it a couple of seconds for the powder to work itself out, and you can spray it around the area. So you see that spraying there. If you want a much thicker layer of gel, you can open up the lever more, and you'll see it come out in a much thicker sort of mist. When you've sprayed one area and you want to move somewhere else, put your valve down, move to your next site, and just open it back up again. The only thing you need to remember at the end is make sure your lever is down and your powder is off before you pull it out. If you don't do that, you'll spray powder all the way up your scope as you're going through. As soon as the powder's sprayed on, it turns into gel right away. So I'll show you this now. This becomes gel. Alright?
I give it nice firm pull back. Automatic deployment, fires it back. So you don't need to push.
You don't need to pull.
So you're using Boston then, because when you see there.
See, Ellen, you're taking up another 5 seconds, which then you've got to do another patient. Oh. Are we? Really? How is it? No one said. We said 2 months ago, but they just look at me and say.
Mix.
Old chocolate brownie.
Is this what happened?
M&S. Ramen. I want ramen.
Birmingham International, Coventry, Leamington Spa, Banbury, Oxford, Reading, Basingstoke, Winchester, Southampton Airport Parkway, Southampton Central, and more.
So, sasakay ka ng mga platform.
This is our platform.
Yes.
So we will get the seat.
Yeah.
Stay there, I will
Platform kami. Ooh. What's that? We.
Yeah.
C. L. Oh wait, dapat we're going the other way.
Yeah, opposite.
LJ. L M. Okay, it's going the other way.
This is your 1825 Club Country service going to Bournemouth via Birmingham New Street and Reading. After departure, we'll speak to you all again, but for now, find yourself somewhere comfortable to safe. And prepare for departure. We will be departing in around 10 minutes.
Well, he's a bit Boris like actually. I think he had the haircut before Boris actually. Tell everybody I don't mind.
Big bull. Wow. Let's go, let's find her. Where's our platform?
11B.
Oh, right, that.
So big. Big bull. Platform 6, 7. Oh my lord, this 11.
No?
Oh, it's very big. Up and down, like first and second floor.
Like the airport.
That's why there is airport here as well. International.
Where is Manju and Nisha?
I'm not sure. Where's shelf now? 10B. This is 11B. Going down?
Yeah, exactly. So next time we have to come with the